Mhm.
What is up, everybody? It's the Dr. Vibe show here, and I'm your host and your producer, Dr. Vibe, the host of Epic Conversations. And this is the home of Epic Conversations 2020 Best Podcast News Award winner, 2018 Innovation Award winner, given out by the Canadian Ethnic Media Association. I also co host and co produce the only online show in the world for dads and fathers. It's sponsored by Dove Men Plus Care. And through that collaboration, I'm part of a team in 2022 and 2021, reached out directly and indirectly to over 100,000 fathers around the world. So, as always, I like to say you're blessed, highly favored, a magnet for miracles, and a solution for someone's problem. And we always like to bring new friends to the Dr. Vibe show. And this is a morning friend. Like, usually I don't do these things early in the morning, but we are very, very happy to have a new friend. Just a little bit of background before we get into our conversation today. Recently, the Prime Minister of Canada, Justin Trudeau, and the ministers, the provincial ministers, had some meetings in regards to healthcare transfers, and health has become even more so in the last few years a very important subject in the daily lives of everyday Canadians. It was always, but it's been amplified now. So we are blessed and highly favored today to have the Minister of Seniors, Kamal Khera, in talking to us this morning about healthcare transfers. So, Minister, thank you so much for taking the time to share with us this morning.
Absolutely. Well, it's lovely to meet you and to be on your show early in the morning, Dr. Vibe. And to everyone watching, just want to say hello.
Excellent, excellent. So, let's give some background on healthcare, and especially for seniors, because during the pandemic, our seniors were one of the most affected communities when it came to healthcare. So, can you provide a little background before we get into the actual transfer issue?
Absolutely. I think one thing I'll say is, and Dr. Vibe, you may or may not know this. I'm a nurse by background.
Okay.
I've worked in healthcare all my life before I got into politics, including in curing during the pandemic. And you hit it right in the nail. We know, particularly during the pandemic, we saw. Some realities and tragedies that existed in the long-term care homes up close, and I got to see those extremely closely firsthand when I went back to nursing in one of the hardest hit long term care homes in my own community in Brampton. And we know we needed to do more. So we've done a number of things on that front, and I'm happy to talk to you about long term care in general. Um, at that time, we sent boots on the ground. We were there supporting provinces and territories because, as you may know this, the jurisdiction over the long-term care is under the provincial jurisdictions, provincial
Yes.
and territorial jurisdiction. But we have been there. Just recently, also in January, there's Health Standards Organization and Canada Standards Association. These two organizations that worked extremely hard over the last 2 years to come up with national standards for long-term care. This is a commitment that we made to Canadians, and we welcome them. They've done extensive amount of consultations with Canadians, with those living in long-term care homes, with caregivers, with healthcare workers to come up with these standards. And as a federal government, where they're supporting provinces and territories, there's $3 billion that we have put aside to make sure standards of care are met and that permanent changes are made. And we look forward to delivering forward on that commitment. But let me also talk to you about a little bit about the fact that you know conditions of work become conditions of care. And we really need to also make sure that we have better work conditions for our healthcare workers, particularly those personal support workers that work and take care of seniors in long-term care homes in home care. And these are some of the lowest paid, healthcare workers in Canada, and most of them are immigrant racialized women.
Yeah.
And so we made a commitment to them in the last federal election that we're going to work with provinces and territories to increase the wages for personal support workers to $25 an hour, to $24 an hour. And I'm happy to say, with the big healthcare funding, which I know we're going to get into, that we put forward. Part
Yeah.
of that is investing $1.7 billion to make sure we fulfill that commitment, work with provinces and territories to make sure we support our personal support workers, some of the hardest working people that I know I got to work with when I went back to the long term care homes. I always like to share a story of Heather, this personal support worker, during the height of the pandemic, when there was nothing, uh, there was just a handful of people, working in a long-term care. She stayed there for 2 weeks. She did not go home, and she stayed there for 2 weeks because she said there's no one else to take care of my people. And her people were the seniors that she's been taking care of for her entire life. So we need to make sure that we support those that have been taking care of seniors, some of the most vulnerable in our community, because if we need to improve the quality of care in this country, we need to make sure we have the backs of our healthcare workers. We have the backs of those are the strength and the backbone of our healthcare system, and that's why, as last week the Prime Minister met with premiers from across the country, and we put together a historic federal funding package of $198.6 billion over the next 10 years. And just this week, we've heard great news that all 13 premiers
Yep.
from provinces and territories are accepting this funding package, but there's still a lot more work to do in terms of finalizing those bilateral agreements and making sure, you know, money is just it's not the only answer. We need to make sure that translates into real investments, tangible results for Canadians. So I know right now my colleague, the Minister of Health, is on the route meeting with health ministers and premiers across the country, but we'll have more to share in the next coming weeks and months.
Thank you for that detailed explanation. Now we could go deeper, but we only have a limited amount of time. Let me ask, um, federal, provincial, and you had mentioned and you're sharing with us, health in this country is a provincial jurisdiction. How challenging it can it be for at times for the federal and the provincial to work together? Because I'm sure not every province was happy with the amount. I'm sure they wanted more. How did you meander and get to an agreement stage? Because this is a really important situation and subject.
Absolutely. I mean, you're absolutely right. I think, in terms of, the delivery of care is responsibility of the provincial governments of healthcare. And of course, the federal government has a role to play in providing that funding support to them. But money is just not the answer. I mean, we've seen that over the pandemic. We've given $72 billion, to provinces and territories to make sure they have the supports on the ground, whether it was billions of dollars into the long-term care, and whether it was boots on the ground with vaccine procurement. But the reality is, and we've seen across the country right now how our emergency rooms are experiencing so much pressure. We also
Right.
hear from Canadians who have to wait unacceptable wait times, for important surgeries. But also, there's millions of Canadians right now that don't even have a family doctor or have access to mental health supports when they need it or have easily accessibility to that. So we know, we're all very proud of our publicly funded healthcare system, but that we've seen the system not working and to the expectations that Canadians want us to work at. So it has been a lot of, I won't say it hasn't been easy, but I think
No.
what every single, of course, the provincial governments, including our government, I think our goal is to make sure Canadians can take pride in our healthcare system, that Canadians get the support that we've been talking about. So that's why I'm very happy to say the 198.6 billion dollars over the next 10 years to repair the damage that was caused by the pandemic and then prepare our health systems for the future. And these historic investments, we want to make sure they're not just money. I think that we need to make sure that they are going to ensure that Canadians have access to family health teams and health services. We're going to make sure seniors have access to safe, affordable long-term care support, or have community support so they can age with dignity if it's in their communities or if it's in their own homes, which a lot of them want to do. This is going to make sure that they have access to their health information online. You go to a emergency, in Canada, we sometimes in some provinces don't even know if what are some of the vaccines that people have had even as a kid. unless you have your yellow card. It just doesn't
Right.
make sense. You need to make sure that you have access to your online health information online, that your doctors and specialists that you may end up going to, they have that information, so they can best guide you and have the best have the best outcome for whatever your health challenges will be. But also to make sure our healthcare workers receive the support that they need to thrive. And I can tell you, as a nurse, I've seen and worked with some incredible nurses, incredible doctors, PSWs, as I mentioned, but they're struggling. They're struggling. When I started nursing, I remember speaking to nurses that started nursing with me when we graduated together. A lot of them thought about leaving nursing because it's been so challenging over the last few years. And so we need to make sure they have the support. They're paid well, but they also have better work conditions and have the mental health supports that they need moving forward as well. So I know these investments are going to make a huge difference in the lives of our healthcare workers and the quality of life for Canadians throughout the country.
Okay, probably our last conversation piece because you're on digital tour today. How, I guess, two-part question. How are the funds going to be administered? Is it going to be the government giving these to the funds of province, and the province is going to measure? Is that how it's going to work out? And I like, and I have to say, I love how you said age with dignity. I love that phrase. I think you should put that tag. I know ministers can't put taglines under their posts, but I think aging with dignity is very important. So
Absolutely.
how is it going to be administered, this money, and the measurements? Because people are going to say, okay, how do we know it's going to be measured effectively?
Absolutely. And I think that's been part of the challenge over the last few years, right? Because the role of the federal government has been just to give the money to the provinces and territories. And the reality is sometimes it doesn't translate to real tangible results. So we have been very clear with provinces and territories, and the conversations that are happening, they've been very productive. And as you know, most of the provinces and territories have come out and said they will take this funding, but now the real work starts. So, as you know, my colleague, Minister of Health and Minister of Intergovernmental Affairs, they're on the tour right now, talking to premiers and talking to healthcare workers, talking to health ministers right now to make sure that they come up with action plans and to make sure there's real indicators of where and the results will be for each province and territories. Because the reality is, we live in a really big country. The challenges in Atlantic Canada may not be exactly what they are right here in Ontario or some
Yeah.
other parts of the country. So I think we need to look at where the gaps are in each province and territory. So there's of course money available for all provinces, but these bilateral agreements will need to make sure we're looking at to achieving those results. So when you talk about the overarching results that I talked about, making sure access to primary health teams, so whether it is a family doctor or a nurse practitioner, so how many of them will have that in your province. A lot of the time we actually didn't collect that data, so we need to make sure then provinces and territories are sharing that data with us, so moving forward when we make these investments, we know exactly what's needed in what province, so we can be better informed in terms of the gaps that exist and where we can learn lessons from in each provinces and territories. uh, you talked about aging with dignity, and I can tell you, as a minister of seniors, there's nothing more I'm excited about. The fact that by 2031, quarter of the population is going to be 65 plus, and we can build as many institutions as we want, but the reality is we need to make sure, and seniors want to age in their own homes for as long as possible. So we've done a number of things, whether it is billions of dollars that we've given to provinces and territories on home care. But as a federal government, we're doing a number of things. We put together last year an Age Well at Home initiative that provides practical support to seniors on the ground, because sometimes, Dr. Vibe, there's very little tangible things that actually prevent seniors from living in their own homes. They just want someone to come shovel their driveway. They just want someone to pick up their
My
prescription
dad.
medication. Absolutely.
Right.
And those are the things that actually prevents them from making a decision to say, I don't think I can support myself because I can't do these very tangible, practical things. We've also asked our National Seniors Council to look at what an aging at home benefit could look like. So we're doing a number of things at the federal level. I know different provinces and territories have some of these things because again, the delivery of care is under their jurisdiction. But as a federal government, where they're supporting Canadians, this is a game changer of an investment in healthcare. It is going to make sure we improve the quality of care that Canadians receive. I know that we're so proud of our publicly funded healthcare system, and we're gonna make sure that these leads to real results and outcomes for Canadians.
Well, Minister Khera, I want to say thank you for taking your time in your positive productive schedule on your digital tour with us. I want to say thank you again. And as I said to you before we went live, you always have a home here. So would love if you can find some time in your journey to come back and we can take a little bit of a deeper dive. Is there any last comments you'd like to share with our audience?
Well, let me just say, Dr. Wipe, thank you so much for the work that you're doing and for having me on the show. And I'll take you up on the offer to make this
Please,
my home and come visit. And I think it's really important also, particularly for your audience. I know they're throughout the country, but when we do sign these agreements for Canadians from coast to coast to coast in different provinces, I think it'll be important to showcase what that means for them in their own province. So I'll love to come back and share some of
please.
that good news as we move forward. And just know, I mean, our party as a federal government is to support Canadians. Make sure, this is one of the reasons why I got into politics as a nurse, to make sure, we're take health back, give health back to people, because there's nothing without our health. And I think these investments are going to make a tremendous difference in the lives of Canadians, not just now, but in the next few years. So really looking forward to making sure we develop those outcomes and come back on your show and talk about what that means for Canadians.
Well, I thank you so much. And I come from a family of nurses. Actually, my mother was a nurse at Women's College Hospital.
Oh, wow.
So, and a lot of a lot of ladies in my family heritage are nurses. So thank you so
Absolutely.
much for everything you do. And two last things. Remember, don't just manage your time, manage your energy, and remember to give yourself grace.
Thank you. I appreciate that. Thank you so much, Dr. Vibe.
Have a great day. All right. So that was a quick conversation with Canada's Minister of Seniors talking about healthcare transfers. So definitely we hope to have her back. She's doing a lot of conversations today. So I want to say thank you to Allison, her media representative, to setting that up. And I'd like to say thank you for everyone who watched live or on replay. Just want to see here. There we go. All right. So a few last things before we sign off. You can watch replays of the Dr. Vibe Show on YouTube, Facebook, and LinkedIn. Also, you can go to my website, thedrvibeshow.com. Also, would you like to promote your business or service on our show? Contact me at dr.vibe@thedrvibeshow.com. And if you want to touch base with me, there are all the different places. Website, email, YouTube, Facebook, and LinkedIn is the Dr. Vibe Show. Twitter at DRVIBESHOW, and Instagram at the DRVIBESHOW. So as always, I close out with this. Live your life as a dream. If you can dream it, you can make it. Sometimes you have to get small to get stronger. Block assumptions. They aim bigger, aim better, aim higher, aim wider. And one last thing, please follow the Dr. Vibe Show, especially on YouTube. If you follow us on YouTube, follow us and also hit the notification bell. We'll tell you when we are doing more epic conversations. You can also like us on Facebook or wherever you're watching this epic conversation. So, as always, live your life as a dream. If you can dream it, you can make it. Sometimes you have to get small to get stronger. Block assumptions. Then aim bigger, aim better, aim higher, aim wider. Love, faith, and respect. Remember to give yourself grace, and don't just manage your time, manage your energy. Have a great day. Yeah. Listen.